Welcome back, everyone. Now is the time for our first Easter egg of the evening. To unveil the same, please join me in welcoming Associate Professor and Associate Dean Training IIHMR Bangalore, Mr. Piyush Kumar.
Thank you, everyone. So this is a very special day in the history of IIHMR, where we all have gathered to witness the launch of Center for Advancing Digital Healthcare Management, Innovation, Research, and Entrepreneurship, a visionary initiative integrating technology, innovation, research with healthcare. I would request the respected dignitaries on the stage to kindly come forward for the lamp lighting ceremony.
Thank you, everyone. I would like to request Trustee Secretary IIHMR, Dr. S.C. Gupta, to present a token of gratitude to IAS Commissioner, Health and Family Welfare, Sri Randeep D.
Guys, go.
Thank you, sir. I would like to request Associate Professor and Associate Dean Training IIHMR Bangalore, Mr. Piyush Kumar, to present a token of our gratitude to distinguished visiting Professor IIHMR Bangalore and former Director IIITB, Professor S. Sadgopal. Please keep the applause going.
Go, guys, go.
Thank you, sir. We would now like to present a token of our gratitude to Trustee Secretary IIHMR, Dr. S.C. Gupta. Can we have a round of applause, please? Can we please keep the applause going, everyone? Thank you, sir. We would now like to present a token of our gratitude to Senior Advisor IIHMR Bangalore and former Director General ESI, Dr. C.S. Kedar. Thank you, sir. I would like to request Associate Professor and Associate Dean Academics and Student Affairs, IIHMR Bangalore, Dr. Kirti Uday, to present a token of our gratitude to Professor and Director, IIHMR Bangalore, Dr. Usha Manjunath. Can we have a round of applause, please?
So that calls for a big round of applause. Now, I would like to invite Dr. Usha Manjunath, Professor and Director, IIHMR Bangalore, to deliver the welcome address. Ma'am.
A warm and healthy morning to all. In quotes, logic will get you from A to B, and imagination will take you everywhere, unquote, Albert Einstein. Maybe not everywhere, but surely here we are today. A very special occasion to launch Admire, Center for Advancing Digital Health Management, Innovation, Research, and Entrepreneurship at IIHMR Bangalore. ಎಲ್ಲರಿಗೂ ಈ ಶುಭ ಸಮಾರಂಭಕ್ಕೆ ಮತ್ತು ಡಿಜಿಟಲ್ ಹೆಲ್ತ್ ಸಂಕೀರ್ಣಕ್ಕೆ ಸುಸ್ವಾಗತ. With the permission of the dignitaries on the dais, I would like to introduce IIHMR Bangalore briefly. Established in 2004, Bangalore Center, IIHMR, is a premier institute and South Campus of Indian Institute of Health Management Research, Jaipur. With a legacy of 38 years, we excel in the key verticals of healthcare management, education, research, consultancy, and training. Our flagship program, academic program, PGDHM, in hospital and health management, is approved by AICTE, accredited by NBA, and accorded MBA equivalence by Association of Indian Universities, and offers the following specialization: hospital management, health management, health IT, and pharmaceutical management. Our research portfolio includes a number of different kinds of assessment projects: formative assessment, impact assessment, social assessment, skill, quality, and facility, as well as operations, implementation research, health system research, IEC, social behavior change communication, and survey research in many need areas, including RMNCH plus A, NCDs, WASH, nutrition, adolescent health, and many other areas of healthcare needs. We have successfully partnered and collaborated with national and international organizations, Government of India, Government of Karnataka, NHSRC, ICMR, NHM of various states, including Karnataka, Orissa, Gujarat, UNICEF, WHO, World Bank, USAID, World Vision, Plan International, UNFPA, JSW Foundation, HCL Foundation, Access Health International, and many others over the years. IIHMR Bangalore is a NABIT accredited organization for NABH consultancy and training by QCI. We are recognized as an empaneled agency by National Health Authority to improve the quality and standards of healthcare facilities. We are also empaneled by NHSRC Knowledge Management Division for Implementation Research in Health Services and Karnataka Evaluation Authority. We are recognized as a key resource center by National Jal Jeevan Mission for training. The Learning and Development Center at IIHMR Bangalore aspires to bridge the gap in skills and knowledge between professional teams and healthcare industry. Our multidisciplinary faculty team consists of physicians, public health experts, IT, social change innovators, data analysts, health and hospital management specialists who are equipped and skilled to conduct high-end research projects and addressing emerging health issues. Now we are moving into the space of digital health. We've been planning, and we are very happy to be here today for launch of Admire. With the boundaries in the physical and digital world blurring, and digital becoming a new normal in all aspects of life, IIHMR Bangalore is reimagining the healthcare management education to keep pace with the digital economy by its new initiative. This is the Center for Excellence Promoting Advancing Digital Health, Management, Innovation, Research, and Entrepreneurship. Admire will focus on addressing challenges of research, data validation, data quality, ethical reviews, testing, and market adoption of emerging digital health technologies to support startups. We plan to bring research and education into the incubation space with Simulation Center and allowing innovation and entrepreneurship to flourish along with capacity building, skilling, and upskilling of the healthcare sector personnel. I, Usha Manjunath, on behalf of IIHMR, would extend a very warm, hearty welcome. Welcome to Honorable Chief Minister of Karnataka, Shri Basavaraj Bommai sir, who has kindly consented to launch the Admire virtually by his message will be given out for us. A very warm welcome to Shri Randeep D, IAS, Commissioner, Health and Family Welfare. Welcome, sir. Special welcome to Professor S. Sargopan, sir, Distinguished Professor, former Director, IIITB, our Margadarshi. We welcome Shri S.D. Gupta, sir, renowned public health specialist and Trustee Secretary, IIHMR, our mentor and guide and a real supporter for all the new initiatives and everything we do at IIHMR. A warm welcome to Dr. Kedar, sir, retired IAS and former DG ESIC, our senior advisor, energy engine, driving us all to do more, strive harder. A very special welcome to our executive committee, Dr. Shyam Vasudevarao, founder, director, Forest Health, Renelix, RX, DHP, Mr. Praveen Srivatsa, director, Assosoft, Dr. Uma Nambiar, MD, Zeden Science Private Limited, Dr. Shashi Bhaskar Krishnamurthy, director of clinical education, intensivist at Cloud Physician, Mr. Mohan Ram Natarajan, former director general, ARNET India, Dr. S.B. Vikram, founder of Vikram Hospitals, and also I kind of thank and welcome our international advisory committee from Burjeel Hospital, Abu Dhabi, ICT Healthcare Dubai, and Strategic Consulting, JLL, Mina, Dubai. A very special welcome to Dr. Parimala, Director, SIHFW. Thank you for coming and joining us, ma'am. We also have 30 plus expert speakers from healthcare, digital health, and tech sector. Welcome to you all. I would now like to welcome our knowledge partners, startup exhibitors, learned, enthusiastic delegates, media partners, very senior hospital administrators, managers from very well-renowned hospitals, my dear colleagues, and everyone present here. Once again, a very warm welcome to all the dignitaries on the dais and off the dais. Welcome one and all. We're going to learn from you, listen to you, debate, discuss, and work very hard to make our dream admire a successful center. Mattomme ellarigu shubha korutta ee samarambhakke suswagata. Thank you all. Namaskara.
Thank you, ma'am, for this warm welcome and giving insights about IIHMR Bangalore and the Admire initiative. Now, I would like to request Dr. S.D. Gupta to context for the ceremony. For you.
Thank you very much, Piyush. Let me, at the outset, welcome the dignitaries on the dais, Dr. Randeep D., Health Commissioner, Dr. Sadgopan, Dr. Usha Manjunath, Dr. Kedar, distinguished speakers and guests, and very dear students who have been part of IIHMR for quite many years and also presently. I'm very delighted and excited. Honestly, I must say that it is truly a world-class beginning of a very important transformative process of digital healthcare. You know, when the Indian Institute of Health Management was established in 1984 with the idea to improve efficiency and effectiveness of healthcare, to improve standards of health. And our focus was management, and we created a new discipline of health management at that time. So not only that we created a new academic discipline of health management, but we went ahead to create and set agenda for policy in healthcare and development. So policy research, program management research, evaluation, and other areas of research we started focusing. And I'm very proud today to say that over 6,000 graduates, management graduates, specialized in hospital and health management, pharmaceutical management, and development management, and IT healthcare are now turned into change agents. They have totally transformed management of healthcare. And this was not thought of at all. It was never in my mind when we designed this program in 1995, 96, that someday these students will transform the entire system of management of healthcare and hospitals in this country. Somehow this has happened, and we are very proud of it, that has happened. But shall we stop here? And we found the problems for which this health management discipline was created, and we prepared the management graduates, especially trained in managing healthcare. Despite our existence for 37, 38 years, our original problems of access, availability, utilization of healthcare, maybe in hospitals or in primary healthcare system, remains still a challenge. Problems in diagnosis, problems of disease management, problems of monitoring, I think have been further complicated by emergence of non-communicable diseases. So where is the solution? Medical technology that we have been using is always a limit. And we continuously keep on exploiting health technologies for better use, for improving health of the people and their living standards. But yet the challenges continue, and I think the major solution to address those problems of access, availability, utilization, and quality of healthcare lies in digitalization. And we are very happy that digital transformation has initiated. It has started. Our challenge was when we started IIHMR Bangalore campus in 2004, we were unable to bring together information technology friends and healthcare friends together. And our dream was to work on information technology and digital health way back in 2004. That was the purpose of establishing Institute of Health Management Research in Bangalore. But after 18 years of that, I see this we have broken the ground now. And this symposium is the testimony of that. With the help of Professor Sadgopan and Professor Kedar, their motivation and continuity of their availability, their technical support, connecting us with the IT industry and professionals. And on our side, bringing in health experts, hospital consultants, hospital specialists together, I think that has made it possible. So this symposium is in fact a launch pad today to our ambitious training and education program in digital healthcare. Whatever is the name Dr. Usha Manjunath gives to this program. But the purpose is not only to educate and train healthcare professionals in digital health, but also information technology people into healthcare. We have to bring them together. We see our students who graduated from here, they are the content providers and they are the source of information for any software development meant for healthcare or hospital management. But can it be possible that we bring them together and can we initiate the process of building capacity in this country among the healthcare professionals and IT professionals to take on to digital healthcare? You have listened to distinguished speakers earlier. What is the future for digital health in India and elsewhere in the world to achieve our goals of universal health coverage and larger sustainable development goals, especially access to healthcare, coverage with healthcare, quality of care, reducing cost, and continuity of care. You don't have to go out. We have used this digital technology in many other areas. Can we really expand these technology use, digital technology use in healthcare and patient care? I think this is the purpose for this symposium, that we create awareness for this. We bring IT professionals and healthcare professionals together on one single platform, and we start thinking how we can prepare the health professionals and build their capacity, and how do we get IT professionals joining hands with the healthcare professionals in improving the healthcare in this country. So you all are welcome, sir. All friends are welcome, and I see that this particular symposium will give a great impetus to further capacity building and utilization of IT and digital health in healthcare. So thank you very much and very welcome to be with us in this journey of transformation of healthcare. Thank you so much.
Thank you, sir, for your inspiring words. Any initiative by IIHMR is incomplete without your blessings and your words of wisdom. Thank you, sir. Now, moving forward, it's my privilege to invite our keynote speaker, Professor S. Sadagopan, distinguished professor, IIHMR Bangalore, and former director, IIIT Bangalore. Sir, you have been a motivating force, a guiding force for us behind this entire initiative. It's my privilege to invite you on the dais.
Good morning. Let me start in a slightly different way. Let me start with an interesting Upanishad start. It starts like this. Namasadase, Namasadasas Pate. See, normally in all these conferences, what we do, we start with the distinguished members on the dais, and then we go to the distinguished members in the audience. In Upanishad, the tradition was opposite. You start with them, and then come to. Nice, right? And let me start. The most important people for me today are IIHMR students. Okay? And you are actually going to create a new world. See, about a year and a half back, I retired. And then Dr. Gupta and Dr. Kedar came to my office and said, let us do something together. So I had no idea what it is. And you know what professors do, right? We sometimes nod our head without thinking. So that's what I did. And looking back, what an amazing time. And with no intention to brag, I think this day will be marked in gold in the history of this country. I'm not talking in a vacuous sense, because many things have just kind of come. Let me spend a couple of minutes. We, the IT guys, we have been doing digitization. You know, we started digitizing the photographs, and suddenly a company called Kodak. Okay, there used to be a time when every one of us captured our best moments of life, like graduation, wedding, etc. And then that used to be called Kodak moment. But we did something to Kodak. Kodak got its moment of bankruptcy, right? That is digitization one. Then we said that, look, there is something called MP3 player, which kind of transformed into iPod and now into a phone. So essentially digitized sound and made lots of companies kind of go out of business. But in the process, created a much larger business. Nobody thought that digital audio would be hundreds of billions of dollars. And one company called Apple alone makes tens of billions of dollars. So that's something. So coming around, so what happened was we were digitizing many things. Okay. But I think we digitized ticketing, e-ticketing, you all know, right? And we digitized commerce, and we had the Amazons of the world going on. But two areas which are very important, digitizing education and digitizing healthcare. We have been attempting it for long, but with disastrous failure. So I'll take liberty. You know, BITS Pilani, one of the senior persons in Cisco happened to be a BITS Pilani alum. So he literally put millions of dollars connecting campuses, etc., etc. But you know, it was nice. Once in a while, when visitors come, we'll be taken around and say, we can actually talk from Pilani to Dubai, Pilani to Hyderabad. But every time it is a demo, it never became real. And it became real due to a completely unexpected thing called COVID-19. And suddenly you found that in a Halli, a high school or an elementary school teacher puts out a whiteboard and his little son or daughter is holding a mobile camera and she's teaching to the world. And of course, when I was in US, so we were traveling from one city to other city. My friend was telling me, oh, we have to pack also our COVID certificate. He was kind of struggling around and he asked me, hey, did you take the COVID certificate? I said, yes. You did not even do any search. I said, no, I sent a WhatsApp. He said, WhatsApp and getting a COVID certificate? Yes, that is what we do in this country. And not a small country, a country of 1.3 billion people. Right? And that is what COVID actually kind of made us do. So but these are only the tip of the iceberg. So what we are going to see in the next 2 decades or 3 decades, we will do the entire end-to-end digitization. And once we do that, as Satya Nadella of Microsoft says, that a significant percentage of the human population will be in carrying profession. Satya puts it very nicely. 300 years of engineering, we have made human beings tend to machines. You know, I have to look up to this fellow to find out what is my calendar. Right? So lots of things like that. But I think soon, human beings will tend to human beings and machines will tend to machines. We don't have to waste our time tending to machine. Anyway, so that is going to happen. But more interesting stuff. What happens in this country is interesting. Professions started to talk to professions. You know, academia and industry, for long, we had a reasonable amount of distrust on each other. But I think IT industry changed it. For 20 years, I think you could do a PhD and also work for a company called Microsoft or a Google. You can be working for Microsoft and you can teach in Infosys or you can teach in Indian Institute of Science or IIIT. So these kind of opportunities never existed. But I think things change. But what is not changing, and that is what we are attempting to change starting from day one, and that is where I need Dr. Gupta's help, Dr. Kedar's help, Usha's help, everybody's Randeep's help, and all of your help, is to make professional talk to professionals. So, you know, I think we engineers in this country, we go to doctors only when we have health problems. We never try to spend time. See, we go to other professions to understand their problems, come up with solutions. But when we went to doctors, we only went for medicine. And let me also take the liberty with doctors. The doctors actually said that, look, engineers are good, but they are not good for our work. So, you know, with due respect, they will say that, look, if a Philips machine comes or a GE machine comes, and as long as somebody is trained in Germany or United States, we would trust them. Okay? But if they are actually going to be your own guys, we may not trust. If it is going to be manufactured in India, you know, we are not sure, etc., etc. So that changed again due to COVID-19. I don't know how many of you know, IIT Kanpur, from a bottoms up, created a full-fledged ventilator, designed, prototyped, developed, manufactured, all in months, and they could actually be in the field. So we should give credit to COVID that also was possible, and we could actually kind of make the engineers and doctors together. So what was really pleasant surprise to me when I went down to see the exhibition spot. Amazing exhibition. So we are so tired of seeing one more e-commerce startup, but I actually find that startups really trying to solve the real problems of the doctors. Okay, so that is where we get excited, and that is the reason why we have been working on Admire for so long. And Dr. Gupta must have been getting impatient with us. We are taking too much time. Sir, we took time, but we will deliver. So, but you took time, but you know, I think the sheer quality of presentations, I listened to some of them, I'm going to listen for the rest of the day. The sheer amount of the intellectual power of the people assembled in the hall actually tells us what is in store for Admire. So we will change the world. So before I close, what I expect to do during Admire is, obviously being an academic institute, we will teach certain things and also make you experience things. And we also will kind of tell you some new tricks, but much more important, we'll create new opportunities, both for grown-ups as well as for startups. We want the startups to grow, and we want the grown-ups to actually take the startup spirit. I think that is special about Bangalore. A company like Siemens works like a startup in Bangalore, because that is what is the speciality of this city. And in some sense, you know, historically in this country, we have these three devatas, right? Saraswati, Lakshmi, and Shakti. And digital healthcare represent these three. There is digital, that's what we guys understand. And health, Dr. Gupta and others have been, but we also need to get the care part of it. I sometimes find care is a better word than management or business. Digital health care. If we get it right, we would get all Lakshmi, Saraswati, as well as Shakti in place. And I do expect that, you know, historically in this country, there are two brands which are well known. And somehow people think that they are winning brand. It's called IIT and IIM. I had the privilege of teaching in both the systems. Okay. And normally what happens, engineers running companies, big companies, you know, today, you know, they are running not only big companies in this country, three fellows are running three big companies, IBM, Google, and Microsoft. I had the privilege of knowing all of them as students. It's nice. Okay, so what happens is we should expect something similar. I want more doctors to actually do business. And doctors running businesses, we do have a couple of people sitting in the road, proud physician, etc. But I would like that to become a routine, just as we take it for granted, right? Engineers running business is taken for granted. Why can't doctors also run some interesting businesses? And I think that would be the turning point for digital healthcare. And that is what is going to be the mandate for Usha. Change this world. So you create a new paradigm, just as we have the IIT, IIM paradigm. It could be MBBS, other degrees, etc. But the healthcare people also getting into management and creating value. And if we do it right, in all humility, we will actually be trendsetters for the world. We are not followers of the world. We'll be trendsetters for the world. And that is the mission. That is why we get excited. Thank you, Dr. Gupta. Thank you all.
Thank you, sir, for bringing out the essence of integrating technology and healthcare, keeping the fundamentals strong. Now, it's a great honor for me to pronounce that today we have received blessings of our Honorable Chief Minister, Sri Basavaraj Bommai-ji. Sir has shared his best wishes in a note. With respect, with permission of all the people present over here, I would like to read out the note presented by Sir. I'm extremely happy to formally launch Admire, which brings under one group ethical clearance, data validation, research, and incubation for health startups by synergizing health, technology, and management. I'm away and not able to be with you in person. I wish Admire all the success, and I congratulate IIHMR Bangalore for launching a unique platform, first of its kind in India. Thank you, sir, for your kind words. We are blessed and motivated to make a difference and change in the healthcare sector. On this auspicious day, we are blessed with the presence of our special guest, Sri Randeep T, IAS Commissioner, Health and Family Welfare. Sir, we are eagerly waiting to listen to you. I request you to kindly share your thoughts with us. A big round of applause for Sir. Thank
you. Very, very good morning to all of you here assembled. Happy to be part of the Digital Health Symposium today on Admire. Firstly, would like to extend my gratitude to Usha ma'am and Kedar sir for having invited me here at this occasion and to share the stage with legends like Professor Satgopan and Dr. Gupta. And very happy to be addressing young minds, the future of India, students, innovators, digital innovators, specifically in the area of healthcare, because that is something that concerns me presently, having been in this sector for the last 4 years in various assignments. As they say, no power on earth can stop an idea whose time has come. I think digital healthcare's time had come long back, but somehow in the government sector, we took our own time to kind of converge the efforts. Secondly, even in the private space, while we did see innovations in digital healthcare, they largely existed in silos. So what has changed in the last few years has been the thought process of how we could converge all efforts and bring it on a common platform. With 60 crore smartphone users in the country and data rates being one of the cheapest across the world, I think this is a ripe platform for digital innovators, especially in healthcare, to take the leap ahead. The Honorable Prime Minister's vision on Digital India is known to all of you. As a state, we are no less behind. Honorable Chief Minister, Shri Basavaraj Bommai, and our Honorable Health Minister, Dr. K. Sudhakar, have been emphasizing how Karnataka has to be at the forefront. leading this digital innovation, especially in healthcare. And for that, there are a few things that the state has done effectively, which I'd like to share with you over the next 2 minutes. We probably have the largest number of facilities, probably 400 plus facilities under a common HMIS system, Health Management Information System, thanks to thanks to the homegrown NIC. And these have been very well adopted, integrated into our system. Today, if you go to even a small PHC, not all of them, but a few PHCs are very comfortable working on this system. We have community health centers using them, taluka hospitals using them, medical colleges and district hospitals using this platform. Seamlessly, we have adopted this initiative. We have made doctors, we have made healthcare professionals start using this platform. The announcement of the Government of India schemes like the e-Sanjeevani platform enabled teleconsultation drives across the country. Karnataka stands probably in the second place in the entire nation for the largest number of teleconsultations. The recent drive, of course, has been the IIHMR Bharat Digital Mission, which was announced by the Honorable Prime Minister recently. Now, here too, Karnataka has been at the forefront. We have tried to push for creation of IIHMR Bharat health accounts amongst individuals. We have tried to register hospitals under the health facility registers. All doctors, nurses, healthcare professionals are being given unique IDs to identify themselves on the digital platform called the Health Professionals Registry. So what are we trying to do here? Overall, we are trying to get interoperable health systems on board. The ABDM tries to create a common level platform in which digital systems which exist in silos can be brought onto the same platform so that data becomes seamless. If a patient today visits a private hospital and has to visit a government establishment where he knows a doctor, he can actually digitally fetch his records. He could fetch his prescription. He could fetch his lab records. And with consent, he could share it with the government doctor. And the government doctor would be able to view his X-ray, his CT scan. So that is where we are headed. That is the kind of platform that the country is geared today and has already been providing. Now, here's where we require the private healthcare professionals, the private hospitals to come on board quickly, register on this platform, make all your digital interventions ABDM compliant. We already have a lot of innovative applications today becoming compliant, and we've been using quite a few of them in the government sector. In fact, one of the simple innovations that we could drive through this, through ABDM was something known as the fast track counter. You would have seen the rush that is there in OPD counters across government hospitals. So we did a simple QR code kind of intervention where the minute a patient comes in, he just scans a QR code on his mobile. And then because he already has his ABA ID stored, or if he's not, we help create the ABA in about 30 seconds. The digital data is stored and pushed remotely to the e-hospital system which is available. All his demographic data is pushed. He doesn't have to stand in the queue. He goes and sits. He waits till his counter number and the registration ID pops up, token number as they call it. And when it pops up, he just goes to the counter, just tells where he has to do his consultation. And then the OPD slip is printed in the next 30 seconds. So saves a lot of time. There is convenience. Just to illustrate that what digital technology can do, what kind of use cases it can have for individuals. It's just a simple example. A simple kind of intervention like this has ensured public comfort. Close to 15 to 30 odd hospitals will be on board in this fast track OPD system by the end of this month, and we hope to expand it to all the hospitals. We are looking at digital literacy too, because a lot of patients who come, a lot of common rural folk who come, do not know how to use a smartphone or how to create an ABA ID. So a digital literacy awareness campaign needs to be also rolled out parallelly. There's no point just telling that digital solutions are available unless the common man is able to use it to the best of his ability and how it's going to help him. Unless we teach him or her that, I don't think the full benefit of this is going to be experienced. So these are just few of the interventions that the state has been taking up. I'm sure symposiums like this will throw up a lot of innovative ideas. I stand here before you welcoming any new innovations that you would like to bring to the government fold, any ideas that could help integrate private healthcare systems with government. As I said, the National ABDM platform is available for all of you to integrate in the coming days. I'm sure this symposium has helped bridge that digital divide which did exist in the healthcare system. And in the coming days, Karnataka as a state and the country as a whole is going to lead the next digital healthcare transformation across the world. Thank you again for having me here, and best wishes to you.
Thank you, sir, for enlightening us about the digital healthcare initiatives changing the landscape of India. In order to bring about the macro level change, the entire healthcare industry stakeholders has to come together. Sir, now I would request you to kindly formally inaugurate the Center for Admire. Thank you, sir. And that calls for a big round of applause. I again thank you everyone for being present in this forum today and blessing us with your gracious presence. Now, moving forward, I would like to request Dr. C.S. Kedar, retired IAS, former Director General, ESIC, Senior Advisor, IIHMR Bangalore, and a wordsmith, a guiding force for us, and an energy engine. There are many adwords which we have to describe, sir. So over to you, please. Yes, sir.
Okay. Maybe first time in my life, I'm trying to do something called vote of thanks. I haven't learned much. So vote of thanks. I feel that this is a privilege today for a change, that I'm doing it something at the age of 68, first time, vote of thanks. But before that, I would like to tell one thing about Ramandeep. When he offered you that you can go and meet him and tell about your innovation and you want to work with the government, he actually means it. So I am telling you, don't take it as a formality. You can go. He is very positive, proactive, and willing to be very accommodative. So please go and meet him if you want anything to work with the government. Okay, so please give a big applause to him for that offer. And he means by that offer. Okay, before going to the vote of thanks, three things that I would like to share it with you, because Praveen is there, he's always inspires me. Long ago, of course, they all addressed me as Director General ESIC. I'm very, very proud about that. There is no second opinion about that. There's a stall of mine also, ESIC. At that time, we had a 1,200 crore computerization plan. I'm deliberately using the word computerization plan. At that time in the world, that was the highest amount, 1,200 crores. Subsequently, in the globe, later on, Nandan Nilekani's Aadhaar was a little more costlier than that. So, Wipro was our system integrator, and I used to almost once in a fortnight, we used to interact with Azim Premji, and of course, I remember Kurian more because he was coming earlier and then later on he became CEO. I did ask certain questions to him because I felt then, but later on I got very convinced when I was trying to work with Praveen that what we were doing was not digital healthcare. We were only computerizing ESIC operations. Very simple. It could have been a hotel, hospital, or a restaurant. It didn't matter. It was the same thing. I don't think when I asked a few questions to Azim Premji about some things that I felt that I didn't know that digitization of health and computerization of hospital processes systems are two different things at that time. But without using this terminology, I asked a few things. Then Azim Premji told me that whatever I'm thinking is not even available in the labs of the US. And he told me that it's not possible. Of course, I thought that the IT industry always, if there's a change of request, that's called, I think, request change or something, then you have to pay more money. I thought that he's trying to avoid. Knowing people, that government, we don't pay even the agreed amount, so asking for a bigger one. So I thought that he's. But only when I met scientist Dr. Raman, I don't know whether I should call Ramandeep as a scientist or a doctor from Cloud Physician. Then only I understood that what Premji told me was true. And that whatever that thinking was there at that time, which is a digitization of health, was not possible then. And Cloud Physician put me into a mode of looking at that. That is one experience that I would like to share, that digitization of health and hospital system digitization are two different things. And probably IIHMR is going to take care of the second one. Second thing that I would like to is, unfortunately or fortunately, I was part of a startup at 64. So I became a startup at 64. Too aged, but I couldn't help it. I noticed that if any system that you do in health, and you can implement without the ethical clearance, very simple definition. If you don't need any ethical clearance to implement that, collect the data and throw it up like whatever ESI did, then it is not digitization of health, it's digitization, computerization of processes. So unfortunately, I was in the digital health space, doing an exoskeleton. But don't wonder how come this fellow looking like a skeleton became a part of exoskeleton, but that's part of the game. Then I noticed that there is something called, you can't just collect a data like anything. You can't analyze a data. You can't take up a research. You can't do anything on any person, anything, without something called an ethical clearance. And it was very, very difficult. Forget about research. You have to do some research. We had to do some research, but it's not possible. So that is where, fortunately, Annatha Sharanam Nasti, Guptaji Sharanam Mama. So nowhere I could. So then we went to Guptaji and we said Sharanam. And then fortunately, they have a wonderful ethical committee which can give you world over recognition. Today, I'm so proud that such a thing is now will be available to everybody else thanks to Admire. That's a great day for me. You should give a big round of applause to Gupta ji, that dream that not just Kedar who could manage, but hundreds of health startups. You have all this problem, research, data collection, ethical clearance, etc. It's very, very difficult. One more small thing that I would like to tell. Thanks to, again, Praveen and EMITS. One of the things that it troubled me when I was DGSI. I know some of the doctors are here. They may be very unhappy with my observation. Of course, fortunately, my friend ran away, so I am very happy. Vishal Rao is there. Otherwise, I hope he has not changed his seat. He's still there now. So he doesn't agree with this view, but I always felt that doctors do a lot of routine work. They spend a lot of their time on routine work, which is not necessary, which is not critical or crucial. And if you take that out, you can increase the efficiency of a doctor. I don't know, Dilip is happy or not happy, but that's possible. But he is also, to some extent, he has done that. But I can feel that we can increase the efficiency by a factor of 10. To put it otherwise, we always keep telling that India doesn't have a doctors, right? We always say that ratio is very low. With what my thinking is, if it gets into the system, you can just increase the number of doctors in India by a factor of 10 without starting any medical colleges or without any students joining any medical college. With the existing, whatever is the thing we can do. Fortunately, AstraSoft and EMITS have agreed with this. And again, thanks to IIHMR, because you need for that ethical clearance, data analysis, etc. As usual, we had gone to Sharanu of Gupta ji. So, lots of our people, because I have interacted with a lot of health startups, please take this opportunity. I'm very, very proud that this is something that IIHMR is providing. I would like to end something before I really go to what I'm expected to do. In all our investment investment campaigns, road shows, etc., Government of Karnataka, including Ramanadeep, they always say that Bangalore has IIM, we have Indian Institute of Science, etc. Possibly in coming days, when they go for raising investment, they should say that Bangalore has IIHMR. So please invest. They don't cite IISc, they don't cite IIM Bangalore, but they cite IIHMR because health is going to be the big thing. Number one, now I will have to do my routine work. I'm sorry, very important work. So I'm very, very grateful to CM. CM yesterday spent more than 10 minutes with us and he was very, very eager to come and be with us. But in the morning here, so then immediately he sent a message to us. So I'm personally very indebted to him. Thank you, sir. And on behalf of all of you, I'll convey that message to him. Of course, I'm very, very grateful to Randeep. He has been always kind to us. I know he was also associated with my malnutrition fight in CFTRA when I was TC myself. He has been always positive. I'm grateful to Randeep. And without you, numbers cannot come. We can go to any private hospital anywhere. But if we want to do any experiment with our ethical clearance, we need your numbers. And I'm very, very grateful to Professor Shedgopal. In fact, I feel I'm the Purohit who got married health and digital because I was the go-between between Gupta ji and Professor Shedgopal. They were actually 10, 12 minutes away from each other. Yeah, they didn't get married for the last 14 years. So I went as a Purohit and Gupta ji. Then I'm grateful to Gupta ji that he accepted my proposal and he agreed to get married. So that was a great thing. Gupta ji, I'm very, very grateful. But for this, yeah, it has to be after marriage. I'm so grateful to Gupta ji that he agreed and Admire has come. I know that we had to think a lot. It was not that just we could, because we didn't want to be one of those who ran. We wanted to be the. So we are grateful to Guptaji. Of course, all the IIHMR people to whom myself and Professor Gopal, we kept on torturing. So all of them today, at least I can thank. But today's greatest thing is about the type of people who have come. I'm extremely grateful to each one of you. I think the cream of the people have come, and actually you inspire us a lot to do more. I'm grateful to each one of you. And of course, I'm grateful to our future students who are going to be spreading this digitization of life. I am grateful to all the people who have made these arrangements. Anybody else have forgotten? Usha, I've deliberately forgotten. Where is the question of thank you? Okay, I'll thank you also, Usha, for having helped us in doing this. And thank you very much. Thank you.
Thank you, sir. Thank you, ma'am. We thank all the dignitaries for taking time out and coming here. Thank you, everyone. Can we have a round of applause for them, please?